came back to Canada with his MRI in his hand, went to see his family doctor. He was given a May the 27th date to see a neurosurgeon. Now this is back on the 3rd of February.
I was angry at the waiting of 3 months.
He didn't want to wait till May the 27th, knowing he had a tumor.
So I got on the phone to Timely Medical, Mr. Rick Baker again.
Once again, we went back to Buffalo.
The surgery was scheduled for within a week's time. Our GP said go.
Lindsay McCreath got his brain surgery in the U.S. The results of the biopsy? Cancer. Luckily, a well-contained grade 2 astrocytoma tumor.
If that had been a class 4 astrocytoma tumor, he would not have made it. He would not have lasted 8 months. He would have, in all likelihood, have died. He would not have made it. He would not have lasted 8 months. He would have, in all likelihood, have died. He would not have made it. He would not have lasted 8 months. He would have, in all likelihood, have died. We compressed the whole process from the MRI to the consultation, the biopsy, to the surgery in 4.5 weeks. Lindsay's doctor, family doctor of 35 years, Dr. McGee, estimated he might have waited as long as 8 months.
The Canadian government's monopoly on health care is slowly crumbling in the face of widespread suffering. Liberal Democrats in the U.S. are pushing to adopt a system much like the one that has failed so miserably in Canada.
Now, I understand that there is a movement afoot in the U.S. by certain circles to try and duplicate the Canadian system in the U.S., trying to adopt a single-payer system in the U.S. Then where will I send my clients? I'll have nowhere to send my clients. Your hospitals will be backed up. You people will be waiting 2 and 3 years for surgery. I'll have nowhere to send Canadians.
Now here's an Ayn Rand Institute press release. They'll send this to you free if you just go to their website and sign up for these things. The press release talks about a letter that they had published somewhere, and this is titled "The Deadly FDA," August 10th, 2007. Irvine, California. The Court of Appeals for the District of Columbia Circuit recently ruled that terminally ill patients do not have a right to take medicines that have not been approved by the FDA. So it's not even experimental medicines. Now, let me just make a quick editorial note. Sam Walton was saved from cancer by experimental medicines. And they've now ruled that patients do not have a right to take those. So he was saved by medicine he willingly took at a very, very, very high cost that later became approved because he submitted himself to experimentation. And anybody who doesn't like Walmart, remember that Sam Walton submitted his life and the breath he breathed to an experiment to see if certain medicines would cure cancer. If you think he doesn't do anything for humanity, screw off. Anyways, here's what the Court of Appeals says. They say you don't have a right to take such medicine if the FDA, the freaking federal government, doesn't think you should. Quote, barring individuals from choosing what medicines to take is immoral and destructive, said Dr. Yaron Brook, Executive Director of the Ayn Rand Institute. Continuing the quote, the decision about what drugs to put in one's body rightfully belongs to each individual, not to the FDA bureaucrats. To deny individuals this right is to impose a death sentence on those who, in the face of certain death, would rationally choose to accept the risks of an experimental treatment, but are barred from doing so until the urgently needed drug completes the FDA's onerous, years-long approval process. Indeed, this case was initiated by a group founded by the father of a girl who died after she was denied access to an experimental anti-cancer drug the FDA later approved. So you see why that would get some people's panties in a bunch. The child's dying. There's this drug you haven't approved yet. Can we try it, please? It would be a good way to test it. right? Here we have a real life human we could test it on, not a dog or a pig or a cat, but a human. We're going to submit voluntarily to test this medication. And in the name of protecting us, the government has said that you cannot take such medication until they have approved it. And by what means they approve it is, how do you approve it if you rule out things like that? So they later approved this medicine. That's the sickest thing about it. Continue the quote. Individuals in consultation with their doctors should be free to assess the evidence of a drug's effectiveness and safety, taking into account their own personal context, such as their unique risk factors or the fact that they are certain to die without treatment. Some people may take ineffective or harmful drugs, but FDA approval does not eliminate such risks, right? Even if the FDA approves a drug for the market, it does not mean that people are not going to take ineffective or harmful drugs. They'll continue to take drugs that are not effective, and they will continue to take drugs that are harmful. Even if the FDA approves every freaking drug out there, still people will harm their bodies. So why not allow them to potentially harm their body if they're going to die? Now this is why, if back in the day someone said we have to have the federal government protecting us at least from adulterated substances. We have to have at least approved medication, because medications, our lives depend on the medication we take. We can't have just any old company coming out with pills and, people go take these pills. So you got to have the government approve stuff like that, and the government has to inspect restaurants and whatever else. So they say this is a minimum, and what's the government ever going to do is bad? Well, first of all, they screw up everything else you mentioned. But at the end of the day, what they're going to do that's bad is stop you from taking medication that could save your life, because they haven't put their little freaking bureaucratic check marks by it. So that's what they're going to stop you from doing at the end of the day. And you think it's a pragmatic step. You think it's just practical at the time to keep someone from selling you adulterated substances, snake oil. By the way, if you're buying herbs like ginseng, whatever the St. John's wort, whatever the new one is, you're already buying snake oil, so you're not, you have nothing to worry about. Get rid of the FDA. No matter who you are, it's in your best interest. No matter who you are, if you're a human being that's alive, the Food and Drug Administration should be abolished tomorrow. Today, it's past midnight, so we'll do it tomorrow. Quote, some claim that, freed from the necessity of gaining FDA approval for new medicines, greedy drug companies will sell ineffective and dangerous drugs, adulterated substances and snake oil. But a company that sells such drugs is only ensuring its own financial destruction. And if a company knowingly misleads the public about a drug's safety or reliability, knowingly, or is negligent in putting a dangerous drug on the market, it should properly be prosecuted if it knows it's a dangerous drug and it sells it anyways. It should be prosecuted. That's what the courts would be for. That's why I'm against anarchy, because then you couldn't have courts to protect your rights like that. But that's what the courts would be there for, is to hold people accountable. But, it says, and it continues, the solution is not to give the FDA bureaucrats the power to condemn sick people to certain death. And that's the power they currently have. They can condemn people to absolutely certain death and say, even though there's a possible medication available, we haven't studied it enough to let you take it. So die. They have the power to do that in America. Quote, some claim that allowing individuals to take unapproved drugs will make effective clinical testing impossible, since, as they say, no rational person would willingly submit to the double-blind, randomized tests that are currently used in clinical trials required by the FDA. In such tests, some of the participants are unknowingly given a placebo, which, it's said, no one would chance if he could ensure that he received the drug by paying for it. right? But